part 2 of the Unit 5 lecture here on animal genital urinary diseases. We're going to cover pyometra, bovine metritis, mastitis, and then MMA. So let's get to the content here. So the first one that we'll hit on is pyometra, which is very highly correlated a lot of times to some of the diseases that we covered in the prior section, especially when you talk about retained fetal membranes. Pyometra then is an infection of the uterine mucosa, which is essentially an accumulation of pus in easy terms that occurs within the uterus there. And so it's pretty common after postpartum infections, whether it's metritis or retained fetal membranes. That we're going to talk about metritis here in a couple slides, but again, somewhat common and occurs in basically all species. Clinical symptoms of this is basically you'll find anestrus. You'll find animals that do not show any symptoms of estrus at all, usually because of incomplete recession of a corpus luteum, or simply they're carrying that infection in the uterine tract, and therefore just the stress causes them not to come into heat whatsoever. It could be just a little amount of pus, or up all the way to 3 gallons, which I know is maybe a shocking number, but I've actually witnessed a cow that had a pyometra and had about three gallons sealed up in the uterus. And what happens is maybe they had a localized infection in the uterus that we thought we got them over. The cervix closes down and seals off that uterine tract, and that infection is still developing to some extent in the uterine tract there, and so then it just becomes yellow to white pus that just accumulates there and is not ejected out of the uterine tract. And so the best way to diagnose it is by palpation. Treatment is simple hormone therapy, kind of get that stuff ejected out of there. You can pass a pipette up into there and siphon it off, and then go with some intrauterine antibiotic treatment. I know that the last two are problematic because you have to know that you are removing more pathogens than you are introducing. Anytime that you go into the uterine tract, you want to be as sanitary as you can. And so that's problematic occasionally, is you could be dragging more bacteria in than you're cleaning out. So if you have to go to siphoning that out or intrauterine antibiotic treatment, make sure that you have consulted with your veterinarian and you know exactly what you want to do. Following that one then, which is, maybe I should reverse the order on these, is bovine metritis, which is an inflammation, at times a serious infection of the uterine area itself. So the cause is oftentimes lack of sanitation, maybe associated with dystocia, with the calving process, treatment of retained placentas. Artificial insemination can cause it. This is a sexually transmitted disease, so if you have natural service sires out there, they can be spreading metritis. But sanitation during the parturition process or in calving, farrowing, foaling can introduce bacteria up in there. So a clean parturition area, clean utensils if you have to assist an animal through the parturition process. All of those things are very critical in preventing metritis. Clinical symptoms is you'll see and smell severe uterine discharge. It's dark red to brown. It's you can smell an animal, but sometimes before you can see them, and oftentimes results in some kind of fever going along with it. Prevention, again, use sanitation when pulling calves or working with retained placentas. Treat all those retained placentas carefully. I've got here listed with intrauterine antibiotic boluses. That is okay. I think the more common accepted practice right now is certainly moving towards a more systematic hormone therapy to try and get that stuff to eject out of there. But be on top of these, because certainly as long as that problem persists, even at a subclinical or less than really nasty level, you're delaying that cow from rebreeding. Treatment, again, intrauterine antibiotics. I talked about those. Intramuscular prostaglandins, I think, is the much more accepted strategy at this point in time. so as not to invade that uterus any more than necessary. But be on top of this one, because it can, again, associate with all kinds of other problems. Whenever you have a cow that has metritis, she's much more susceptible, many times, in fact, more susceptible to ketosis. She's many times more susceptible to displaced abomasum that we talked about in the prior unit. So be on top of these particular problems with metritis. Turning our attention to mastitis now, most costly disease in the dairy industry, and I've got listed $200 per cow per year is what it costs the dairy industry right now. Not just in affected animals. That is kind of industry-wide number, and it's moving northward towards 300. A lot now in the industry. It's just an inflammation of the mammary gland, and so it causes obviously losses in milk production, damages milk secretory cells, can cause systemic illness. You can have an animal that's obviously visually sick and not just in the mammary gland, and occasionally can lead to death. So you have to be proactive here. Again, caused by bacterial introduction into the mammary system itself, into each quarter or gland. It's related to a number of different things, whether it's T-den trauma, infected milk, improper machine function, dirty environment. So you have to be aware of all the types of things that you need to have protection against, whether it's maintaining good teat-end, making sure that the animal is on high health plane, because they need to have immunoglobulins. They need to be able to fight this stuff off and kill mastitis causing pathogens themselves. That's called spontaneous recovery. But sometimes it just overwhelms them, and then we have a problem. Mastitis is categorized into two separate areas. It's either contagious mastitis, which has transferred that pathogen. Staph aureus is the number one here. Number one contagious mastitis pathogen we'll talk about in a second, must live in the presence of milk. So it has to be transferred in the milking process, either on your hands or in the machine from cow to cow. It is the most common type of disease, and that's Staph aureus when you talk mastitis. So what you see is a steady increase in somatic cell count, which somatic cell count is the measurement of those mastitis causing pathogen cells in the milk. And the udder, actually, as it tries to fight off the pathogen, it does something that sounds like a great idea, which is wall off that pathogen in the mammary gland, but it actually somewhat protects it, because then it's very difficult for you to treat it, because it's kind of walled that off inside the mammary gland. And so any antibiotic therapy that you inject in there, it's very difficult for that to work. So oftentimes you'll see subclinical symptoms. So you won't see the normal chunky milk, the flaky milk. It'll be oftentimes subclinical, and then you'll have spikes occasionally. So it responds very poorly to antibiotics because of that walling off feature that it does with Staph aureus. So prevention is your best method of handling Staph aureus, or culling animals that you culture and find out that they're Staph aureus carriers. You can treat them. Dry cow therapy is probably your best mode of action in trying to knock this out, but it's somewhat limited success occasionally. Strep ag is the less common contagious mastitis pathogen. Very similar. This one again is very responsive to dry cow treatment and teat dipping. So a lot of parlor procedures can help you minimize contagious mastitis problems. Next is environmental mastitis, and these are all related to poor environmental conditions and poor environmental sanitation. Dirty stalls, a dirty parlor, dirty hands, things of that nature. And so these bugs, we'll talk about the first one here, Strep uberis, carried on your skin. So the easiest way to prevent that one is just simple teat dipping, and then wear gloves for yourself. It multiplies in the bedding, so clean bedding. Sand has really cut back on a lot of the environmental mastitis problems. This one is really common during the dry period, because sometimes folks don't maintain the dry period dry cow pens maybe quite as cleanly. So don't lose focus there. Next is coliforms, and these were probably the most common one here. E. coli, Klebsiella, things of that nature, your gram-negative type of mastitis. So again, unsanitary milking conditions. These are pretty severe infections. These are ones you'll get the really hot, hard quarters. The cow will probably be systemically feverish. Um, she goes right off milk really quickly, probably stops eating as well. So be aggressive here. Next one is Mycoplasma bovis. And boy, if there's a nasty one in the list, this one is it, because the milk comes out almost like, and I don't want to gross you out, but almost like yogurt. And it smells bad. And a really sharp drop in production, and you have a very sick animal that if they get mycoplasma, it's very difficult to treat. And those you probably take care of just through culling and prevent spread by proper hygiene. So be proactive on those type of animals. Clinical symptoms: if you have clinical mastitis, I mentioned the hot, hard quarter, the swollen udder, the clumps, flakes, curdled, stringy milk, fevers. Those are clinical symptoms. Subclinical mastitis, you'll have elevated somatic cell counts without clinical symptoms, which is really costly because you're losing milk production. A somatic cell count greater than 500,000 on an animal is a 10% loss in milk production. And so you're losing milk and not even know it, and you're losing milk quality. So detection through the bulk tank testing. Our current legal limit in the U.S. is 750,000. If your herd surpasses that, you don't get to ship milk anymore. So prevention, clean machines, sanitary procedure, clean environment, good dry cow therapy, treatment protocols, intramammary infusion of antibiotics is really critical, whether it's over-the-counter or prescription drugs, but most likely work with your veterinarian and make sure that you follow all milk withdrawal periods. If you have to go systemically and treat with intravenous or intramuscular antibiotics, make sure that you read and follow all label directions on those types of things. Last one in the list here is MMA, or mastitis metritis agalactia, which is a swine-related disease, and each component may occur alone or in some combination of the three. We've kind of talked about all three of these, so I think you have a fairly good concept of what we're referring to here. Again, you'll find very similar pathogens that cause these types of things. Clinical symptoms in swine is appetite loss, fever, foul-smelling discharge. You'll see one of the mammary glands is hot or hard. They maybe won't stand or disregard their litter they're supposed to be nursing. They may exhibit some or all of those symptoms, or just a couple, dependent upon the disease extent. Prevention, again, very similar types of things to bovine mastitis and problems. Sound management, really good nutrition, clean sanitation in the pig barn, and then just good animal husbandry. And simple, manage good body condition and reduce whatever stressors are out there. Treatment: if you've got a sow mother that's got a swollen quarter and therefore can't service all of her pigs that she needs, piglets, then cross foster some of those litters to a normal, healthy mother. Use antibiotics and oxytocin. Milk replacer sometimes can help as an option. And then lastly, oral antibiotic to the piglets. That helps with disease transfer to them, because obviously anytime that you have a problem with mama sow, then you're also at risk for the baby piglets developing, whether it's a respiratory disease or scours, as we talked about in the previous section. So that concludes part 2 and finishes up our discussion here on Unit 5, Animal Genital Urinary Diseases. Again, make sure you review your notes and your supplementary materials before attempting the assessments in this area. Best of luck to you.